Hello, I guess we can kick off. Hello to our audience and welcome to another panel discussion run by Vayu Global Health. My name is Nellyann Ndumi, the Seller Experience Manager at Vayu Global Health. A big aspect of my role is managing supplier relationships across the African, European, and Asian markets. And for those of you new to Vayu Global Health, we are a global health distribution channel for medical equipment and supplies across low and middle income countries. And started in 2015, Vayu Global Health so far has touched more than 5 million lives in more than 90 countries globally, and the numbers keep rising every day with every sale facilitated through our distributor network. And in today's session, we'll be diving into innovation in oxygen access with a special focus on the LMIC regions. And I'm sure none of us are strangers to the challenges we faced in terms of oxygen access during the COVID-19 pandemic. And so a discussion around this and potentially more ideas and innovation across this will be beneficial to us. So joining us today are two experts from their respective fields, Mark and Michelle, and I'll hand it over to them to introduce themselves and the companies that they represent. So we can start off with Mark.
Thank you, Nellyann. It's a pleasure to be here with you and the team today. My name is Mark Adkins, and my personal career has been in the area of product development for multiple decades, and it's something I've done both in a corporate environment and consulting. So I've always been involved in new product development. More recently, I was a professor at the University of Pittsburgh and taught managing medical product innovation in the bioengineering department, which is where LeanMed, our company, started as a result 5 years ago, as a result of one of our students traveling to Malawi and witnessing firsthand so many deaths from pneumonia for children in particular. And that inspired the beginnings of LeanMed and our product, the O2 Cube, which I think we'll discuss quite a bit today. It's a solar-powered medical oxygen production system intended to reach the billion people in the world today who live without access to medical oxygen. So it's been a wonderful 5-year journey from a student project to now shipping product into Africa and making oxygen available to, in particular, in pediatric wards to those children that need oxygen so desperately. So I think I'll stop there. And Michelle, I guess you can.
Hi, thanks so much for having me. So my name is Michelle Dundek. I'm the Director of Engineering at Vayu Global Health Innovations. I studied mechanical engineering at Dartmouth College with an emphasis on applications for global development. So I've worked on projects looking at hydropower in Rwanda, designing hospitals in Haiti, and now working with accessible medical devices. So the topic today of oxygen access is really important to what we do. Oxygen is so versatile, it's used all over the hospital, but it's also such a complex product because it requires this ecosystem of different stakeholders to make the oxygen, transport it, and then deliver it to the patient. So our emphasis at Vayu Global Health Innovations is once the oxygen has made it to the hospital, whether it be through a plant or through concentrators, however it gets there, to make sure that it reaches its end goal of being delivered to the patient in a safe and effective manner. Because oxygen, of course, is a drug, so it needs to be delivered in the right dose and delivered in a way that is optimal for the patient. So we have a couple of products centered around oxygen delivery for newborns. We have a bubble CPAP system. It's the first high quality bubble CPAP system that doesn't require electricity. It's currently in 22 countries, and we're working on scaling up to more hospitals with this device. And we also have an oxygen blender system for low flow oxygen delivery, because in most settings, 100% oxygen is still being used for low flow delivery, and this can be toxic, especially for newborns who are vulnerable to retinopathy of prematurity and bronchopulmonary dysplasia. So making sure that they get the right concentration they need is really important, and that's at the core of what our products and our mission is doing. So thank you so much for having me, and looking forward to discussing more about oxygen access.
Great. Thank you so much, Michelle. It's lovely to have you on our panel today. That's been gratefully organized by our marketing director, Persis, who is on the panel with us this afternoon. So we can just dive right into the questions. And in your various experiences, what have been the key challenges facing LMIC regions, especially in ensuring that an adequate and reliable supply of oxygen exists for the medical centers and hospitals?
Sure, I can talk to that a little bit. So we of course focus more on the final step of delivering the oxygen to the patient, but we've recognized that it is a whole ecosystem of different stakeholders that need to work together to make this happen. So you need to somehow create the oxygen, concentrate it, and then deliver it to where it needs to go, and then actually get it to the patient. And if any of these steps aren't taken, then the patient won't get what they need. So one of the greatest challenges is making sure that all of these parts are working together smoothly, because it's not just a product that you buy and then you use it and that's it. You need to have a continuous supply of it, so that creates its own unique challenges to work in this space.
Great. Thank you for that. Do you have anything to add to it, Mark? I'm so sorry, Mark, we can't hear you. Yes. Okay, so as Mark fixes his mic, I guess we can just head on to the second question, which is how can infrastructure investments contribute to bridging the oxygen gap in LMICs, and subsequently what specific measures should be taken to establish robust oxygen production, storage, and distribution systems?
Okay, I can talk a little bit about this. I think this might be a little more Mark's area, but while he fixes his mic. What we've seen is that there's not really a one-size-fits-all solution. There are different kind of oxygen sources that work well for different places depending on what their resources are. So I wouldn't say that there's one specific model that we should, that will work everywhere, but to continue to explore these different models of like different kind of oxygen production plants or high quality oxygen concentrators, and to figure out what works best in different settings, and make sure that we're investing in things because we've done the right research and know that it will work well to get the oxygen to the patient, and not just trying to fit one solution on everything, on every hospital that needs oxygen.
Nellyann, can you hear me? Yes? Okay.
Yes, now we can hear you.
I apologize again. If you could hear me before, my power went out. Fortunately, I'm solar backed up. So it's that or the smoke coming in from Canada. I'm not sure what's causing it. Can you repeat the question? I heard Michelle say it might be more in the work that we do. Could you repeat the question?
Yes. My pleasure. The question was, how can infrastructure investments contribute to bridging the oxygen gap in LMICs, and subsequently what specific measures should be taken to establish robust oxygen production, storage, and distribution systems?
Oh, thank you. Excellent question. Yeah, and so I'll answer it a little bit from the LeanMed perspective with our solar-powered O2 Cube. There's traditionally, I'll talk to people about access in the LMICs. There's a kind of three rings of infrastructure. In city centers where there's a high population density, you'll see the presence of liquid oxygen production as a primary source, being the highest volume, the most efficient way to produce medical oxygen, but unfortunately also the most expensive and very energy intensive. As you go outside of the city centers, you find PSA plants, which have come on quite a bit since COVID. And in many of the countries now, you're seeing the build out of PSA, pressure swing absorption plants. They'll produce anywhere, the smallest might be at 100 liter per minute production, up into the thousands of liter per minute production rate. What's lacking, and what we've tried to address with the O2 Cube, is maybe it's not the last mile, maybe it's the last 100 miles. It would be maybe a better way to frame it. But there's a third ring in many of the LMICs where, due to either non-existent or unstable grid electricity, there is no economical way to deliver medical oxygen to hospitals and clinics. And that's where the O2 Cube comes in. Being solar powered, we are able to get outside of this lack of grid electricity, or serve as a backup where the grid electricity is unstable. So, speaking to the infrastructure, we believe what we've done with the O2 Cube is create a third solution. There's liquid oxygen, there is PSA plants, and we refer to the O2 Cube as micro PSA. So for those of you familiar with around the world, there are microbreweries around the world. We'd like to be, if you will, the microbrewery of oxygen. And we'd like to bring the ability to produce oxygen economically and reliably into these towns and cities, supporting the hospitals and clinics that today are without it. So that's the kind of infrastructure we think is needed to reach the last mile, to reach the billion people that today live without medical oxygen. Thank you.
Great. Thank you so much, Mark, for the insight. So hopping on to our third question is, what innovative and affordable solutions can be implemented to enhance access to medical oxygen in resource-constrained settings, and how technologies like on-site oxygen generation systems, such as your Oxygen Cube, Mark, and renewed energy-powered concentrators play a role in this particular region?
Yeah. So the key, I think one of the keys is when we envisioned this 5 years ago, we immediately thought of solar power. Solar energy has continued to develop and will continue to develop, becoming more efficient, more cost effective, and so on. The other side of the equation, that's the supply of the electricity required to operate medical oxygen devices of all types, but in our case, the production of medical oxygen. But on the demand side, the key is power consumption. And we're very fortunate in that we licensed a technology from Philips Healthcare called the UltraFill, which is a very low energy oxygen compression system. They can fill cylinders to 2000 PSI, but one of these UltraFill devices only consumes approximately 100 watts of energy. And for those of you who have worked in the solar field or have tried to implement solar solutions, you realize that it's the demand, it's the amount of energy required to operate your device that can be so critical. And so we're very fortunate that we have a licensing agreement from Philips for that technology, which is at the heart of the O2 Cube, and enables us to effectively operate this 10 liter per minute production system called the O2 Cube with a reasonable amount of solar panels and a reasonable battery supplying it. So supply coming from the sun, which is very plentiful. Also supply coming from the air, right? So one of the beautiful things about operating a medical production system like the O2Q is that the inputs are free, sunshine and air. So once you have the system up and running, your operating expenses are quite low. But you have to keep focused on lower power consumption. And perhaps if we have time today, we'll talk about the move that's going on among oxygen concentrator suppliers in terms of developing oxygen concentrators that consume less energy, which will be an important part of building out the infrastructure. Over.
On the patient delivery side of oxygen, there's a lot of innovation going on right now to figure out affordable solutions to deliver safe oxygen, which is really great. What's so important is that making sure we recognize the limitations of the resource constrained settings that we're in. And we're starting to get better at this, I think. If you look at, for example, the CPAP space that we're in, there's been recognition over the last several years that the CPAP systems used in high resource settings are just really not practical for low resource settings. So there's been different innovations around trying to make something that's appropriate and accessible for low resource settings, but retains the quality needed to treat patients. So one of the initial limitations that was recognized is that these traditional CPAP machines, they need compressed medical air, and medical air is much harder to find than oxygen, even though it's just air, but to find it compressed in a way that will be able to power these devices is not that common, because most of these facilities, they just have 100% oxygen, so that's what they're delivering to patients, but that can be toxic. So it's important that you have some source of air to be able to blend it with the oxygen to deliver a safe concentration to the patient. So the early innovators in this space recognized that medical air was one of the problems for resource constrained settings, outside of just the price of these devices. So there's innovations around trying to eliminate the need for a hospital infrastructure to have this compressed medical air. And a lot of the innovations ended up using some kind of electric pump or other source to pump the air into the device, which did eliminate the need for medical air. But it does create a little bit of a new problem because many facilities don't have reliable electricity. So you're taking one problem and kind of substituting it for another. And there are, of course, facilities that will have, like the larger ones or in the cities will have reliable electricity access. So we were making progress. We were getting CPAP to more places that need it. But I think it's really important to continue innovating and trying to address as many of these resource constraints that you can. So that was where we came at our approach and looking at the CPAP space, was to try to figure out if there's a way to really use the least resources possible, but to still deliver that high quality therapy. So if you look at what resources places have, oxygen access is not ubiquitous, but it's pretty common, especially in the facilities of a level that should be treating patients on CPAP. They typically have some form of oxygen access. So seeing if we can use that to power the device essentially, instead of needing oxygen and air and electricity, can we somehow use what places actually have and is required so that we can just use that to power the device. So our bubble CPAP system, it uses the power of an oxygen concentrator or a tank to drive a Venturi blender. So this is a kind of blender that is just a simple plastic injection molded piece, and it has a nozzle in it that funnels the oxygen so that it's going in a high velocity jet that's also at a low pressure. And this jet passes through an open window where it pulls in the surrounding ambient air. So instead of using a electric pump or using a high pressure medical air source, we're just using the medical air in the room, or just the ambient air in the room, to get the blended oxygen concentration that we want. So this has a couple of different benefits to it. It of course reduces the infrastructure needed. It also makes it so the device doesn't need any electricity. And it makes it a lot easier to maintain now too, because one of the other challenges of these resource constrained settings is that there's very limited bioengineering capabilities. So to reduce the burden as much as we can on the hospital and the staff to maintain these devices is really important. So I think just continuing to challenge ourselves to innovate more and to really dive into the challenges that these hospitals are facing and see how we can work with them while we work in tandem with, of course, with increasing the infrastructure, making sure that they ultimately, every hospital should, of course, have reliable electricity and medical air. But in the meantime, how can we innovate around what resources they actually do have to make sure that patients are getting the quality of care that they need?
And maybe to just build on what Michelle is discussing, and this can also be on a case-by-case basis. Part of the things is just essentially going back to the first question. What are some of the issues happening in these countries? If there's very low storage, this was already proven during the pandemic. If the distribution networks do not work, if something like the pandemic happens again, are we ready? And the answer is not always a yes. For many of the hospitals in these countries, even the governments themselves may not even have that capability to supply. For example, in Africa, we do have health center 3s that are down to the village level. So there is also a touch on saying the distribution networks still need a lot of building up, and also just the capabilities and the training of the technical staff in these places. That said, all of this obviously has to be sustainable for the hospital or the health center to go on. And that is where products like the AutoCube come in. How can we use what is already existing? And the innovation around such things is what can keep us going, and it is what can keep oxygen production and just getting it to the people that need it in the time that it is needed be available. So things like the mobile oxygen units, just even openly sourcing designs and sharing the knowledge for whether it's across governments, across countries, it is something that is needed. And the work that LeanMed, the work that Vayu does, using things that can easily be either reused in terms of the oxygen blenders, things that are one-time establishments and use resources that are already existing in these spaces, sun, air, to be able to add into the distribution network, and also just presenting an option to have stored oxygen directly from the air that is existing. So I really see that innovations more towards that direction not only speak to continuous supply, but also address emergency preparedness and a resilience of the channels, and just creating a pathway for even having more people trained to push this to various hospitals, more and more countries. And some of these are single buys, so where places that the government comes in and says, oh, we can't afford this, this is a single purchase. So taking away also that financial constraint on a lot of low to middle income countries is another very, very big key point. And innovations in that direction, in my view, are the direction we should be headed. Yeah, thanks.
So could I reply to that or speak to that, Ben?
Absolutely.
Yeah, so in terms of innovation, there's 2 points when I was listening that came to mind. One is the innovation around business model. And we're part of a program out of the UK. At LeanMed, we're part of a program called the TPP. And it's funded by UNICEF and the Foreign Commonwealth Development Organization, FCDO, at the UK. It's called Better Futures CoLab. And we're modeling today, as part of the team, the idea of oxygen as a service or oxygen as a utility, meaning healthcare centers will no longer have to own and maintain the equipment, but simply be provided oxygen as a utility just like electricity, just like gas, just like water. So we're part of that program. We have two partners, one in Nigeria, a company called HealthPort, and then another company in Uganda called IC Change. And what's exciting about this innovation, this is not a product innovation, it's a business model innovation. It says we're going to set up companies like HealthPort and IC Change who will operate something like the O2 Cube that will produce the oxygen, but then basically sell and provide the oxygen to the healthcare centers and hospitals on a subscription basis or on a pay-as-you-go basis. It's my belief that in the next 5 years, you will see hundreds, I hope even thousands of entrepreneurs throughout the LMICs who will set up businesses in their town or city where they can own an O2 Cube and they can produce the oxygen using sun and air. And they will be able to deliver that oxygen to these healthcare facilities. And what it helps is the healthcare facility is no longer required to staff and try to support the production equipment. They simply use the oxygen as needed. So if we have time later, I'll have to find the link, but it's a wonderful program. We're in phase 1 of it, and we have 2 systems going to Nigeria and 2 more going to Uganda that's part of this. And there's some really good papers and some really good literature out there on this notion of oxygen as a utility. Path wrote a very significant paper about 2 or 3 years ago that talks about this oxygen as a utility concept. So that's something I think people who are interested in getting oxygen to the people that need it, this business model innovation is very critical. As far as preparedness for the next pandemic, hopefully not. I think one thing I would like to mention that we've done with the O2 Cube, we designed it in a way that it can fill any cylinder manufacturer and any size. So it's not limited to just say the large tanks that you see on the back of trucks. We can fill small cylinders as well. So what we see happening already, frankly, in Nigeria, is that you can now make oxygen available for patients in transit. So I think this will be it was a critical gap during COVID, and I'm hoping that if we can deploy sufficient number of O2 cubes in the LMICs, not only can we fill the large oxygen cylinders that are used in the hospitals, but fill smaller cylinders that can be used for patient transport. By our estimate on the pediatric side, the work we try to do, we think 80% of the pediatric deaths due to pneumonia, which is around 800,000 a year, we think 80% of those deaths occur before reaching the hospital. They happen outside the hospital. So when you think about it, as much as we want to bring oxygen to the hospital and pediatric wards and make it available, that may be only 20% of the children that are afflicted with pneumonia. The other 80% perish before even reaching the hospital. So that's why the idea of smaller cylinders, more economical delivery of oxygen is so critical. So thank you. Over.
Okay, thank you so much for the great insight, Persis and Mark. And so we'll just jump into the third question, which has partially been answered already, thanks to the very great insights from Persis. And I would just want to give you a chance to brag a bit, to talk about the success stories that have come from your individual products, especially in the LMIC communities.
I'm definitely deferring to Michelle. You have a lot more successes than we do, so I think you should go. You go first. We're early days, so.
Yeah, we've been around for a little bit now, and it's been a really exciting journey for us. When I first started here, we had kind of the concept for the bubble CPAP ready, but we're still figuring out how to manufacture it and how to get it to the places that need it. So we're currently in 22 different countries, anywhere from like the US, Kenya, Tanzania, India, Belgium, Brazil, kind of scattered around where we've seen different opportunities arise. And we've learned a lot from going to different settings. Some of our earliest implementers were in Tanzania, and their feedback was really valuable to work on the device and improve it and make it as rugged as we could for these settings. So we're really excited that we now have a manufacturer located in Kenya, in Mombasa. So they create the devices there and then they ship them out directly. So nothing needs to funnel through our lab in Boston. And to, for example, we just started in Ethiopia, and to be able to say, hey, we have a manufacturer who is very close by, can get you the supplies that you need quickly, has been really instrumental to making sure that we're developing a sustainable supply chain for our devices. So we're really excited in this next phase to look at scaling up a little bit more. We've kind of started in a lot of the major hospitals because we've seen that there's such great need, and these are the hospitals that see the highest volume of patients, and a lot of them, they didn't have either any CPAP or enough CPAP for their patients, because we've seen a lot of hospitals they'll need 30 CPAP systems. So if you're looking at the ones that we use in high resource settings, they're about $10,000 each. So that adds up very quickly. So to be able to get the volumes to these hospitals that they need is really important to treat all of their patients. And we're looking now in the future to kind of trickling down throughout the chain. As Mark said, transport is really, really important. Most of the patients at these major hospitals aren't born there. So they're transported from lower levels facilities. Making sure that they have the support they need during transport is important. So that's been a focus of ours that we're looking to dive into a little bit more, because a lot of the aspects of our device make it uniquely suited for transport, because it doesn't need electricity, it doesn't need medical air, but it is still able to blend in an ambulance setting. So that's something we're looking at. And then if the facility is well enough equipped to take care of this patient, and all they need is a CPAP machine, then making sure they get those CPAP machines so we don't have to transport them to the larger facility. We can kind of clear up some of the congestion at these higher level facilities. So there's certainly a lot of work ahead of us, but we're excited to really try to expand access to CPAP and other oxygen blending technologies to make sure that it's reaching all of the patients that need it.
Yeah, definitely. And having you work together with Revital has shown a lot of improvement in terms of the movement of the CPAP, and it being, I think, the only CPAP that doesn't need electricity works especially well for the LMIC regions. So just with that thought in mind, with working with different manufacturers and I guess facilitators in the spaces in the LMIC regions, what collaborative strategies or efforts have you seen showing promising results outside of the ones currently being implemented, for example, by Vayu?
Just relationships are always really important. We did a lot of canvassing before we found a manufacturer that we were comfortable with. And Revital is really committed to the mission of making sure that these devices are accessible to everyone that needs them. And they're also incredibly active with us, and just constant WhatsApp messages to each other and working together and collaborating through really good communication to make sure that we're as nimble as possible, because working in so many different settings and countries, you never know what's going to come up. So to have a partner that we can work with dynamically to make sure that we're answering queries effectively, getting the product where it needs to go, whether it be a whole new country that we've never shipped to before, and figuring out how we can get it there, make sure it's in a timely fashion is really important. And just recognizing like partnerships everywhere, whether it be with our manufacturer or distributors or different aid organizations who might be interested in distributing the device themselves, is so important because everyone has different strengths and different knowledge that can really help to make the product successful and impactful, and kind of deferring to them if they're an expert in a particular region or they have an experience with a particular part of the oxygen supply chain, to try to not work in a silo and make sure that we're playing on each other's strengths so that we can all be successful together.
Right, and maybe just to jump in here, some of the collaborations, there are certain collaborations that can take just the distribution a lot further. And this is the part where we need to look at the adoption of technology overall, right? Sadly, it's also, these are the same markets that are also riddled with a lot of corruption and several other things that are a lot harder for us to individually solve. Whether it's the health workers not knowing how to use, or even being open to using the new technology, or even just trying it out. So how do we facilitate and put ourselves in a position where there's a bit of training that can be available for them? That is one of the functionality, that is one of the functional ways we can insert ourselves in those spaces. And just also making sure the health bodies and all the stakeholders that could perhaps be included, the doctors, sometimes even the political forces, because these are the people that drive whatever happens in these hospitals. And those are the hospitals with the highest traffics, the government-powered hospitals. And just being able, when you streamline that network and you have the training, and there's an efficiency that is brought about by a technology that allows production of oxygen to be done on premise and take away the hiccups of the delivery is late, or there is no manufacturer in that area. And that particular part, for that gap to be filled, makes it very easy. Even with just companies like Vayu Global that say it doesn't matter which part of the world you are, as long as you are able to, we are able to ship to you, that is a very good chance. If we're able to get an audio crib somewhere in Haiti, then you're saving millions of lives, just because somebody locally is able and willing to learn how to use this or set up this particular device. So that's one of the ways I see this playing off between manufacturers, innovators, and just the local entities on ground.
Agreed.
Absolutely. And Mark, as LeanMed, are you looking to partner with any other manufacturers, innovators, distribution channels in the LMIC space that will help the uptake of the oxygen cube?
Yeah, I think there are a number of opportunities. I've mentioned one earlier about the entrepreneurs that are setting up oxygen as a service or oxygen as a utility. That maybe excites me the most, only because we're doing two things. We have a little slogan we've used, start a career, save a life. So not only are you making oxygen available, you're letting someone start a business. And that's very much on the minds of people in the LMICs and frankly around the world. There's a little bit of concern at times that you read these headlines and these millions and millions of dollars are being put into the LMICs, and you read these big numbers, but it's very much at times kind of trickle down. It's from big organizations to governments, and by the time it actually produces results, sometimes it can be a bit inefficient. So one of the exciting things about this oxygen as a service concept, or oxygen as a utility, is it's a bottoms up. It's, can we find a way to fund and support these entrepreneurs who want to start a business selling and filling oxygen cylinders in their town or city. So that's one very strong partnering opportunity. And as LeanMed, we're very business to business. We're not aspiring to be highly vertically integrated, meaning we're going to do it all. For us to scale rapidly and bring oxygen to these billion people and to these 800,000 children that die every year, you need speed. And you know, the fact that we've gone from a student project 5 years ago to now shipping commercial product, I'm very proud of that. But we have a lot more work to do. And so to do that, you have to be open to partnerships. So another example would be, we will build the O2 Cube in the LMICs. We're building the first ones here in the US for a number of reasons in terms of engineering and resources. But we're actively discussing today in sub-Saharan Africa, setting up a manufacturing operation where, as Michelle explained for Vayu, the ability to have the product produced locally, have it nearer to the customer, we think is going to be a great opportunity. So manufacturing partners are important. Oxygen as a utility partnerships are important. And then I think the third area is in the oxygen concentrator field. The O2 Cube operates using off-the-shelf oxygen concentrators. So for example, the units that we shipped to Nigeria last week, they're using an off-the-shelf DeVilbiss 10 liter per minute drive, the 1025. So the beauty of that is they're very available, they're relatively inexpensive. We didn't develop something, we didn't try to design our own oxygen concentrator. We've worked with Philips, we've worked with DeVilbiss to have those oxygen concentrators integrated into the O2 Cube. So we're very excited about the DeVilbiss announcement of next year. They're going to have what they call the 1060 AW, and it is an oxygen concentrator focused on LMICs. And in particular, our understanding is it will be a lower power energy consuming device. And as I mentioned earlier, if you're in the solar energy world, anything you can do to lower the energy demand can only makes your product more efficient, less expensive, and so on. So that's a third leg that we have: manufacturing partners, oxygen as a utility partners, and then we're talking to all the concentrator companies about what are they doing to come up with more energy efficient oxygen concentrators that are an integral part of the O2 Cube. So those are three partnership opportunities that we're pursuing. Over.
Thank you, Mark. That's amazing, and thank you for going into detail about the setting up oxygen as a service. I believe that angle will definitely lead to more generation of oxygen in the regions, as well as create employment, and as you said, create a career, save a life.
Do you like that? You like that tagline? I don't know where we made it up, but start a career, save a life.
Put it on a t-shirt and put it on merchandise. It's really good, and it brings up there. So just lastly, I think thinking of the COVID-19 pandemic, I believe your products would have made a big difference if this preceded the pandemic. Obviously, if we had these flagged off before then, but especially for like the Vayu, I know you guys got emergency certification during the COVID pandemic era. So how has that looked for you as a business, and what lessons could be learned from that journey up until now?
Sure. So COVID was a really interesting time for us when it all first started. We, like everyone else, we started to work from home, figure out kind of where our path was going from there. We had kind of just developed the CPAP as a complete product and had done like preliminary field trials on it. So we were ready to start having it in more places. But we thought this would all slow us down. But then it was a week or two into the pandemic, and we started getting a lot of requests for the CPAP because what we were hearing is with the ventilator shortage, there are a lot of settings that, like in the US, where instead of using even the $10,000 bubble CPAP to give a newborn baby CPAP, they'll use a $40,000 ventilator in CPAP mode to deliver CPAP, which is just definitely overkill. It's way underutilizing the functionalities of a ventilator. And there's even some research that suggests bubble CPAP is slightly more effective than ventilator-driven CPAP. So we had a lot of requests because people were saying if we can have other CPAP machines in here, then we can free up these ventilators and start using them for COVID patients. Because there haven't been a ton of cases of mortality in newborns from COVID, so it wasn't so much directly treating them, although we have had a couple of cases of that. But finding this kind of unique need in that specific time to use the CPAP to free up ventilators was a really interesting time for us. So we went to the US FDA and we explained this need that we were seeing and provided them with all of our testing data and our field data. And that's when they granted us the emergency use authorization. So we have sites in the US that are using it now, and that really helped kind of propel us forward to have the credibility there to expand into more settings. So that was actually a really propulsive time for us during the pandemic to start off a lot of different projects that we've been continuing to this day. And we also just learned a lot from all of that experience during that time, and have been taking that knowledge and using it in the past to improve the product, and now to help with our rollout and our scale up, things that we learned about training people during the pandemic. Because previously with our original sites, we would go to every place and train them and help them like physically set up the device because it was our very first site, so we wanted the oversight. But that obviously wasn't possible during the pandemic, so we had to learn how to adapt to virtual trainings, how to create an online training platform. So it was a step that we would have need to have taken eventually anyways, but it kind of accelerated us to do it sooner and to start working out the kinks earlier and making sure that we had a model for training that was sustainable at scale. So all of that has been really helpful as we look to scale up to make sure that we're well positioned to do so.
Okay, brilliant. Thank you. Mark, do you have any input on lessons learned during the COVID-19 pandemic and basically lessons picked up during that as well?
What I'd like to be sure to say, and it's not directly COVID, because as Michelle said, COVID really wasn't, as big an impact on children, newborns, infants as it was on adults. There is a cynical side of me. I was we were actively working with the Every Breath Counts Coalition before COVID. There was a lot of focus then on pediatric pneumonia, but maybe not a lot of traction. And COVID comes along, and now that adults are dying and politicians are dying, suddenly everybody starts to realize, oh my God, there's not enough oxygen in the world. So there's a cynical side of me that feels bad that COVID had to happen to wake up the world to the fact that this incredible lack of access to medical oxygen. But what I wanted to state at some point, just maybe to get it out there, the numbers when we talk about what would happen the next time, if we use the 800,000 children dying every year from pediatric pneumonia, there's been a number of studies done now, one most recently by Dr. Michael Hawkes out of the University of Alberta, funded by Grand Challenges Canada, where they had 20 hospitals and they measured the impact of making oxygen available to children that previously didn't have any. And the mortality rate at over 2,000 patients, mortality rate very statistically strong, demonstrated a 33% reduction in the death rate. So what I remind myself of when I do this work with LeanMed and the O2 Cube. If 800,000 children are dying every year from pneumonia, and if I could snap my fingers and have an O2 Cube deployed throughout so that oxygen is available, if you do the math, that's 240,000 lives every year that could be saved.
Wow.
And yeah, every time I say that out loud to someone, I do still get kind of chills, because it's a staggering number, but it's there. This is not hard math. 800,000 deaths per year, reduce the mortality rate by 1/3. You're saving 250,000 lives every year. So it's a big impact. Maybe not as much as the next pandemic. We'll have to see what form that takes. But I know it's what inspires us at LeanMed to do this work. I think that's the kind of numbers, that's the kind of lives that can be saved by getting oxygen deployed throughout the LMICs. So, thanks. Over.
Thank you so much for that. And we hope for a future where 800,000 is a number that's just listed alongside infant deaths, especially preventable infant deaths.
Yeah.
So as Vayu mentioned, working with manufacturers on the LMIC space, and you briefly touched on potentially looking to work with production and assembly lines in the LMIC space for the oxygen cube. Where do you have your sights set, and do you have a timeline for this? Because I think we're all very aware that shipping fees tends to kill a lot more of the needs to buy products that are essential and crucial to most of these hospitals. So I don't know how far you are in that roadmap of things. So if you have a little more insight to share there.
You're directing that to me, Nellyann?
Yeah.
Yeah. So the plan that we have right now is we call the current O2 Cube our Generation 1, and it's built upon the Philips technology called the UltraFill. So if people look at a photograph or look at the system, the O2 Cube is built upon manifolding together 4 of these UltraFills to produce the 10 liter per minute flow rate. We probably will build the Gen 1s here in the United States for the next year or so, because it is a new product category. It's something new to the world.
Yeah.
Nobody knows what a micro PSA is or what that means. So we have some work to do to educate the market and educate and prove ourselves. But what we call our Gen 2 design, which we've started on, and we're currently talking to manufacturers of some of the technology, I think within a year, by 1 year, we'll have enough O2 cubes in the field. It'll be proven as a new product category, this micro PSA concept. And quite honestly, there's tremendous cost savings. As you well know in your business, the shipping expense, the duties, the procurement of the material. So we have designed the O2 Cube that there is really no barrier to manufacture in any LMIC. Country specific, it's rather interesting what we see, because we're talking to people in South Africa, we're talking to people in Kenya, we're talking to people in Nigeria. So we'll have to see how much demand there is, and where we would put it. It does not require a large space to build an O2 Cube. It's going to be a very a really terrific product that can be made in Africa, or made in India, or made in Latin America. So I think that's all I can say right now. We have our work to do, but we're actively talking to people, and it's definitely in our business plan that we will be building it in region.
Okay.
Over.
Brilliant. Thank you. And to just kind of throw the same question to you, Michelle, I do know Vayu already has an established manufacturer on the continent that's working to create the CPAP. Are you looking into diversifying this, especially in the LATAM space, because they do fall under the LMIC brackets?
Right. That's a good question. So we've learned a lot from setting up a manufacturer, and it is not an easy process. There's even with a relatively simple product like ours, to create the different components in it, you need molds, and commercial grade injection molds are quite expensive. So it takes a significant investment to start up a manufacturer. There are, as you mentioned earlier, shipping costs can be really challenging. So while it's very convenient to have a manufacturer in Kenya and we're distributing to the African continent, be a little more challenging if we're going to Brazil, for example. So we're learning as much as we can right now and kind of exploring our different options. So some options are to have assembly facilities in different places, so you don't necessarily need to set them up with all the injection molds or quite as much equipment. But by shipping them components, there are lower tariffs on that. You can do it in large volumes and bring the prices down that way. Because we've definitely learned that the worst way to do things is to have a facility across the world order one device and then ship them one device. Because the shipping will be a very significant cost in comparison to the actual product at that point. So figuring out how to find distributors that can store product and buy it in larger volumes, to have possibly assemblers in different places, or even if the market is right in an area, to have another manufacturer there, is something that we're constantly learning about and being flexible on, but right now definitely trying to set up our current manufacturer for as much success as possible and learning in tandem with them how to set up these supply chains for a sustainable business model.
Okay, great, thank you. So we have a couple of questions from the audience, and this is directed to you, Mark. So the question is, how do you ensure that the solar panel source is not used for any other purposes and is available for use by the concentrators?
It's a good question. Probably the most important one is just trust. I mean, to be honest, we had this conversation for 5 years now, once we elected to go to solar, and we really haven't spent a lot of time or energy building in that a lockout or you know, there could be ways you could try to prevent that. But initially, the fact that the owners of the O2 cube are going to be these entrepreneurs operating oxygen as a utility companies, they are incented, and this is what I really like. They're very incentivized to get the most out of the O2 cube, because that's how they make money. They're making their money when the O2 cube is producing oxygen. If they decide they want to charge their cell phone, or they want to operate a microwave oven or something else off of the solar panels, I guess that's their decision. They own the O2 cube, and if they want to divert it, they can do that, but they're not making money if they're not producing oxygen. So the first answer is alignment of your business. You know, you have alignment on what your business is doing. The second thing that I would like to mention that I have not so far, the O2 cube is capable of cloud connectivity. So we've built it as a smart device. When we built the previous prototype at the University of Pittsburgh, we set it up with a cloud connection so that I could sit in my office, you know, outside of Pittsburgh, and I could watch and collect in real time the data coming off of the O2 cube. So instead of putting like a hard, what do I want to say, a hard wired way to prevent that, I will be able, or the owner of the O2 cube can be remotely monitoring the usage of the O2 cube and know that, that it's running and it's operating to produce oxygen, in an efficient manner. I think that's something we overlook at times, and it's a little maybe early days, but the fact that we've engineered it to be a smart device so that, for example, our partner in Nigeria, Healthport, who are headquartered in Lagos, but the installations of the O2 cube are going to be throughout rural areas of Nigeria. They will be able to sit in Lagos and know actively if the O2 cube is running, what the temperature is inside the unit, how much power consumption it's using, what's the purity of the oxygen. We monitor all those data points in real time and bring them back to the owner. So those are two ways: alignment of business objectives and having a smart device that has real-time data collection. Those are two ways I think we'll try to deal with this cannibalizing of the power. Over.
Yeah, definitely. Having a smart device will for sure let you know if the solar panels are being misused.
The story that, if I could, the story that gave me some pause was when we started on the O2 cube 5 years ago, and we're doing work in Malawi on a pulse oximetry project. And the story was that there were teams of people at one of the clinics that had a copy machine, a paper copy machine, and they would run so much paper through it, they would get the glass really hot and they would fry eggs on the copy machine. And that's when I realized you'll never know what a customer is going to do with your product. So you just do the best you can and keep your fingers crossed too.
Yeah, that's true. Maybe we now need copiers that have data for it as well. Okay, and for Michelle, there's a question here. How do you manage humidity for delivery on the CPAP?
Yeah, that's a great question. Humidification is really important when delivering CPAP. So historically, there have been different approaches to it. You'll see kind of the traditional device, they'll have a hot plate and they'll put a water reservoir on it and use passover humidification. So they just run the air over the water reservoir and that adds water to it. There have been CPAPs that have kind of tried to simplify for low resource settings and remove the humidifier from it altogether because there's not a huge consensus on what is exactly the required level of humidification for patients because you of course don't want to dry out their airways with completely dry gases because like medical oxygen and air have zero humidity content, but you also don't need it to be 100% humidified at a high temperature. So the number in between isn't exactly known, but we have seen with these devices that don't use any humidification at all, there are reports of nosebleeds in about 10% of the patients. So if you've got a patient who's pretty sick already and then you're adding this complication, you don't want to be doing that. So it's really important to have humidification in the system. So the humidification that the Vayu Global CPAP system uses is a bubble through humidifier. We did a whole bunch of tests on different kinds of humidification, like the passover kind that the traditional one uses, or different kinds of bubble humidifiers. And we found that this version was the most effective for adding the highest content of water to the air. And so we include that in our system. And most of the settings that we work in are pretty warm settings already. And wherever a baby is kept that is sick enough to need CPAP, they also need to be kept warm. So that usually the device is able to capture some of that warmth also, which helps boost the humidity in the system And then additionally, because we have this Venturi type blender that's using the ambient air instead of the compressed medical air, ambient air is naturally humidified. Like if the patient is not on CPAP, they would be breathing that ambient air and they wouldn't be getting nosebleeds from that, of course. So by using ambient air, we're also able to boost the humidity of the gas stream that the patient is receiving.
Okay, thank you for that answer. And I know the school of thought between humidified air or dry air has no solid standing, especially in the medical field. People tend to be for and against it, almost in equal measure. The question that would piggyback off of that is if the Vayu CPAP device itself can be paired with external humidifiers.
That's a good question. We don't currently recommend that just because we haven't tested the system with that, so we can't tell people to do that, of course. The Venturi blender is specific to the system, the way it was calibrated. So if you plug it onto a different system, we can't guarantee that it would function in the same way. It might deliver different concentrations of oxygen than you expect. So we don't recommend using different devices downstream of the Venturi blender. We also don't find it's necessary. We've had thousands of cases of use of the device and we don't get reports of nosebleeds, and we've tested the humidity content of the device and looked at ISO standards and shown that it meets, actually exceeds the recommended amount of humidity in a gas stream for these kinds of devices.
Okay, thank you for that answer. So a question for Mark is this technology available in Ghana, and how can we connect with innovators of the solid power energy, the solid power oxygen cubes, and also how to assess the business opportunity of providing oxygen as a service?
Sure. We're currently not working with anyone in Ghana. We're certainly open to that and would be welcome the opportunity to discuss the opportunity. To get started, like we've done in Nigeria, Uganda, for example, what you would do would be to assess the current situation in your town or city. Typically, I'll give you maybe what I consider the typical example. If there's a rural hospital, it has oxygen. It's probably using oxygen concentrators as the primary delivery method for patients, both pediatric and adults. But because of the lack of reliability of electricity, they typically purchase these large tanks and have cylinder backup. They might use a diesel generator, but not as common. The more common backup is oxygen tanks purchased from PSA plants that can be a long way away. Those tanks can be very expensive. The delivery can be very unreliable, and many times you're responsible for getting them refilled, which is not an easy thing to do if you have to travel a long way, wait in line, get your tank filled, and bring it back. So if you see that use case, if you see that in your town or your city, if you're working with a hospital like that, they're where the O2 cube and the local production of oxygen can really differentiate and we can deliver. I always talk about the cost of oxygen delivered, not the cost of oxygen produced, because you can produce oxygen very cheaply, if you're running a liquid oxygen facility. But what does it cost to actually deliver it to the patient? So I would suggest you understand the demand, what we would be looking for and working with you on. What's the demand? What does the hospital use every week or every month? Are there health centers nearby that could use oxygen? Are there some individuals or private doctors who would like to have access to oxygen. If we can build a picture of what the demand is for medical oxygen in your city or your town, then that's where we can work together to get an O2 cube in there and be providing local medical oxygen production. Is that okay? Make sense?
Absolutely, it does. And just tying in with the question of you of you working with LMICs in terms of producing the oxygen cube. One of our audiences has asked if what specifics would you be looking into for a manufacturer to be your go-to for the oxygen cube production?
Yeah, I think that's a really good question. I think obviously quality, safety are paramount. So we would want someone, it'll be required to be an ISO certified facility. I think, there's so many variables. It would depend on where the demand is coming from. You have different trade blocks within sub-Saharan Africa, for example, that might be proactive. It might be interesting whether this manufacturing partner could also be a user. Perhaps they also would be in the oxygen as a utility business. It's always, if you use your own, we have some sayings in the US, I don't know, eat your own dog food or something like that, right? So if you're a user of it, perhaps you'll be a very good manufacturer of it. I think there's strategic partnerships as well. I don't know who's asking the question, but I think we have opportunities with people who are today building and selling PSA plants. There are a set of OEMs, original equipment manufacturers, who are out there, and some are setting up PSA manufacturing in Africa. We believe strongly that the O2 cube can reach customers that PSA plants cannot economically. It's nothing negative about them, but the economics of logistics of moving tanks, the energy consumption required to operate these PSA plants, we think there are going to be manufacturers of PSA plants who would like to partner with LeanMed in producing the O2 cube. So those are a few thoughts on what we would be looking for.
Great, thank you very much for that. And for our final question, this goes to Michelle. What was your regulatory strategy for the blender and the bubble CPAP, given that it was designed specifically for the LMIC context?
Sure. So we were definitely motivated by the LMIC context when we designed the devices, but everyone everywhere should have quality therapy, of course. So we believe that anything that goes to LMIC should, of course, have the quality of therapy that we would expect in high resource settings. So regulatory has been a really big part of what we do, and we've definitely learned a lot of lessons through the years from working on it. We have our emergency use authorization from the US FDA, which we mentioned before, which is a rigorous process that we had to go through, and it's fully cleared for use in the US, but it is a temporary one. So they haven't put an end date on it yet, but it is something that will eventually expire. So we're also working on getting full regulatory from the US FDA, looking at CE Mark II, because there are these they call them the big five regulatory, known to be the most rigorous regulatory bodies in the world. And to show that you have regulatory from one or more of them is kind of a stamp that the product is of the quality that you would expect to take care of these vulnerable patients. But every single country in the world has its own system, so it makes it really challenging. So we're also working on these different regulatory clearances in all of the countries that we're working in. And you hear a lot of similar requirements from them, but you never know if a country might say, hey, we're coming to Ghana, we really want to see data on babies from Ghana. So anywhere can request different things. So having a team here who is working with all of these different regulatory bodies to understand what they need has been a big challenge for us, but something that we're actively working on. And it helps us to improve and be better, because maybe they'll say something that we never thought of, and it challenges us to make sure that our device is the quality that we want it to be. So it's been a dynamic process, and there's certainly a lot of red tape to jump through, but it's important that we make sure that the devices going into hospitals are of the quality that is expected, regardless of whether it's a low resource setting hospital or a high resource setting hospital.
Brilliant. Thank you so much for that. And as we wrap up, I don't know if you have any final pointers to add from either one of your sides.
I just think this conversation is really great and really important. With COVID, there was so much talk about access to oxygen, and so much money was poured into it, which was great, because as Mark said, this is a conversation we should have been having a while ago, and we were kind of on the sidelines, but it really brought it to the forefront, which is so important. But to make sure that we continue having the conversation, and now that the pandemic has quote unquote ended, of course it has not, but in the eyes of the media and a lot of people, it's not at the top of the list anymore. But to make sure that we recognize that that isn't the only reason oxygen was important, and we continue to have the conversation and put up the resources to make sure we're making progress on this.
Thank you so much.
Yeah, and I would just add that to thank you for this opportunity to do the webinar. Thank Michelle. It was a pleasure listening to you and the work you're doing at Vayu. And maybe just a shout out again, I mentioned earlier the Every Breath Counts Coalition led by Leith Greenslade, the work they've been doing for years, and most recently the WHO passing that I forgot the number, but it was quite a big deal that oxygen should be made available throughout the world, that everyone in the world should have access to oxygen. It's only a document, it has to be executed upon, but I know Leith and the team there, as the Every Breath Counts Coalition, worked really hard to get that passage and get that signed. So my hope is that, you know, governments and NGOs and the private sector all work hard. And, you know, again, for me, striking 800,000 children dying every year from pneumonia. 1 billion people live today and die in this world because they can't get access to oxygen. Those are two awful, awful set of statistics. And I hope if we do this 5 years from now, the numbers will be a lot different. So thanks for the opportunity.
All right. So thank you so much to our audience, and thank you so much to Michelle and Mark for taking the time to join us this evening and morning, depending on what side of the planet you're on. And hopefully, as Mark has said, once we have this conversation a few years down the line, the numbers won't be as bleak as they are today. And hopefully the conversations around access actually become actionable plans, and plans that are in fruition and actually working, and just maintaining the stories and the conversations around making sure the quality of products that head into LMICs are a global standard and not just designed for LMICs specifically. So whatever products come into Africa are the same level of products that are in the States, in European regions as well. And so with companies like LeanMed and Vayu constantly taking the time to understand how each region works and just making sure that they deliver their best, definitely a step in the right direction. And we hope that this is a fast step of many, and hopefully conversations around this will be actual things that we can talk about and reference data and on how it's working across the globe. So thank you so much to the team at VIA. Thank you so much to LeanMed for taking the time to join in. Thank you so much to Vayu as well, and to our audience for joining us from their various locations. So we hope to have you again on another panel down the line. So as you conclude your days, please note that products from Vayu and products from LeanMed are available on our marketplace and are available for purchase. All right, thank you so much and have a great day. Cheers.
Cheers.
Bye.